Hi, my name's Pip. I'm one of the physios at Sydney Advanced Physiotherapy in Lindfield, and welcome to the Sunday Sessions series of videos that we are releasing on Sundays on Facebook. Now, the reason it doesn't look like we're in the clinic, it's because we're not. You're at home with me on a Sunday. Today we're going to be talking about recurrent hamstring injuries. Now, it is really common that if you've had a bad hamstring injury, particularly a tear, that when it feels better and you go back to playing the sport you were playing before, or you go back to running, that you re-injure yourself actually quite quickly. At this point, it's then your second hamstring injury, you wait for it to heal again, and then you try and start playing your sport of choice again, and it happens again. And all of a sudden, you're a person who has regular hamstring issues, and it occurs very regularly when you try and exert yourself and push yourself physically. And it particularly happens with high-speed activities where there is a required sudden deceleration or lots of changes of direction. So I'm going to tell you why this happens really commonly, and the first reason is that the muscle activation strategies, so the order in which you turn on muscles around your hips and your pelvis, that pattern is off. So I've got my handy little pelvis here, and it needs to have movement in order for you to be able to do tasks like run, change directions, salsa, and you need to actually be able to have stability in your pelvis without your pelvis actually giving way and unlocking. And you get that stability from a range of different muscles. One of those muscles that often provides a great deal of support for your pelvis and for your hip is your glutes. Now, when you stand on one leg, what should happen is your glutes should turn on first, and then your hamstrings should turn on. And it should go inner hamstring, then outer hamstring. And what we really commonly see is, particularly when people have a history of back pain or pelvic issues or hamstring issues, is that people, when they go to stand on one leg, either don't turn their glute on at all, or it's really delayed. Generally then the hamstrings kick in first, and it could be the inner hamstring that turns on first, or it could be the outer hamstring first. And that obviously has an effect on how your pelvis and hips then stabilize. Now, trying to use your hamstrings to stabilize your pelvis is a really rubbish long-term plan. It means that your hamstrings are working to try and stabilize your pelvis when you, for example, go to stretch out a leg to take a long running stride or to kick a ball. And so it puts your hamstrings at extra vulnerability for overstretch and strain or for tearing. It also means that your hamstrings are working way harder than they should be, and it again makes them more vulnerable for repeated injury, for tendon problems, and for feeling chronically tight. Now, if this is what your body is doing after your first hamstring injury and you return to the soccer field and you start sprinting after the ball, and then suddenly you have to change directions and then kick, that's asking a lot for your hamstring to do while it's also stabilizing your pelvis. And this is why we see a really high rate of recurrence of injury when people return to sport, particularly in the first couple of weeks after return. Now, the second really common reason we see a recurrence of hamstring injuries is because of poor alignment. And it could be that you've had your hamstring checked and maybe your hip and your pelvis, and you've tried to get that area balanced. But what is not so common is that your therapist looks beyond that region. So for example, if your foot is really stiff, which can happen if you wear shoes that are too small, or if you've had an old ankle sprain, it could happen for any number of reasons. What tends to happen is people then look like they're pronating because they're trying to get their toe on the ground. So what can really commonly happen is if the foot is too stiff, you've got this foot that instead of having an ability to lengthen and shorten is kind of stuck in one position. And if it stayed in a neutral position, usually your big toe would be off the floor. And so what will happen is that foot will then collapse in, so people drop through the arch to get their big toe on the floor so they've got a better balance. When that happens and the foot collapses in, it makes it really hard for the glutes to turn on. And as I've already explained, the glutes are super important in terms of your pelvic and hip stability and making sure that the way the muscles work around that area is as ideal as it can be to prevent overstrain to your hamstring. So sometimes as part of the recovery from hamstring issues, you might need to change the shoes you wear. You might need to have your foot released so that your foot can stay in a proper neutral position while you have all toes on on the floor, and so that your foot has the ability to adapt to all ground surfaces and all movements. A foot that doesn't have the ability to adapt well to any surface or any movement is going to be a problem. And not just a problem for your hamstring, it can be a problem for any part of your body. The thorax is also a common area where we see alignment issues that affect the hamstrings. So the thorax is the rib cage region, including the spine that the ribs attach to. Now, the reason this can affect your hamstrings and increase the likelihood of you having another injury is because you should get the vast majority of your rotation from your rib cage. Yes, you will also get it from places like your neck and your foot, and your pelvis and hip should provide some rotation, but you get a huge amount of rotation from your rib cage. Now, if your rib cage alignment is not fantastic, you lose some of that rotation, and then you try and start getting it from other places, so you start overworking other areas. The other thing that we really commonly see is when people's alignment is off in that area, they're often stuck in a little bit of rotation. And so to try and counterbalance that so you don't feel lopsided, very often people will throw a hip forward. Now, what can happen is if you're stuck in a little bit of rotation and you throw one hip forward to kind of counterbalance that rotation, is you can actually wear through some of the cartilage and damage the cartilage in the hip a little bit by doing that, because the hip is sitting forward in the joint. You can also get excessive tone in the front muscles, so the hip flexors and the TFL area. But you also often end up seeing people who don't turn their glutes on well and who are trying to stabilize their pelvis by using their hamstring. So it tends to wind up the hamstring issues again. So it's really important to make sure that your alignment in the rest of your body is not setting you back up for failure when you go back to sport. The third and also very common reason why hamstring problems can become a recurrent problem is because of the neural drive to a muscle. So when people have a disc bulge in their lower back, for example, that can change the way the nerve sends messages to the muscle. So some muscles might be dampened down in their ability to turn on, and some might be ramped right up. And so these will be muscles that will chronically feel tight. They are often muscles that don't have a great capacity to lengthen, which is very important when you're running or kicking or playing sport. So making sure that you have your other issues dealt with is an important part of the recovery process for a hamstring problem. The fourth and most common reason that hamstring issues become a recurrent problem is inadequate rehabilitation. So your rehabilitation needs to make sure that it checks all the muscle activation patterns around your pelvis and your hip, that you check for anything that might create high neural drive like disc bulges, and that you check your alignment in other areas of your body like in your foot or in your rib cage that might predispose you to a failure to return to your sport. You need to make sure when you're doing your rehab that you learn to move properly and learn to control the joints of your lower back, your pelvis, and your hips so that they're not all moving as one uncoordinated unit. You need to actually be able to keep your pelvis and your lower back in a nice neutral position while you choose to work your hips, for example. And it's the ability to dissociate and to learn to move sections of your body without, for example, taking your lower back hostage that really determine whether your return to sport is going to be successful. As part of your rehab process, you need to make sure the strength of the muscle is properly regained, and you need to make sure that the eccentric strength of the muscle is regained. So I'm going to show you this and explain what this means using my bicep, because that's much easier to pull up to the camera than my leg. So my bicep needs to be strong as it shortens and as it lengthens. And that's really important. So it's your concentric and eccentric strength. And it's really important that that is restored in your hamstring. You need to work on high-level whole body control exercises as well. For example, if you're a runner, it's not just your legs that are working, your whole body is in play when you're running, and you need your whole body to function well as a unit in order for that task to be successful. Now, you might get away with it once, twice, you might get away with it for a week, but this is a common reason why we see lots of injuries, particularly chronic backs and things that don't resolve, is because the whole body mechanics are not working well, sometimes because of a tight foot, sometimes for many different reasons. But running requires your foot to do some things, your knee to do some things, your hip to do particular movements. You need to have rotation in your rib cage. All of these things need to happen in order for you to be able to run and to run well. And failing to incorporate exercises that challenge your entire body's control, and particularly in sport-specific kind of movements, is not going to bode well for your return to sport. You need to progressively increase the speed and endurance demand and the agility demands and slowly work back into sport-specific requirements. If you were a tennis player, for example, and you'd had a hamstring injury and you were getting to the point where you were almost ready to go back, you would start doing lots of drills that would mimic what you were required to do as part of your sport. The last really common reason why people would have inadequate rehabilitation can be obviously a cost issue, but it is very frequently also a prioritization, so a time management issue. So people don't really understand how important it is to incorporate all of these facets into their rehabilitation program, or they find it hard to make time to do their exercises at home, and it's really, really important that you do. Making your rehabilitation a priority is very important for your success when you return to the sport of your choice. The final thing I'll say about hamstring issues is they do tend to get more difficult to treat the more of them you've had. So if you're onto your first or your second hamstring injury, or even your third, go and see a quality physiotherapist who knows what they're doing and knows how to treat these issues. Make sure you have all the bases that I've already outlined covered. Make sure you actually really dedicate yourself to the rehabilitation program. That way, you're maximizing your ability to recover, you're minimizing the risk of future injury, and you're making it so that your return to sport is more likely to be successful. I hope you've enjoyed this Sunday Sessions video. If you have any questions at all, please get in contact with us. You can do so by dropping a comment below, or you can call us 9416 4410, or you can check out our website sydneyadvancedphysio.com.au.